And how are you feeling? A bit out of it. I understand. Do you know where you're at? Your memory is a bit foggy. That's okay. Welcome to Dream Cities After Hour Clinic. I am Dr. Luna, neurologist, and I'm here to examine you today. Pleasure to meet you. Yes. I do see you have quite the bump on your head. Do you remember how you got that? That's what I thought. So, I was just reading your clinic visit from the nurse that examined you a bit earlier, and it said that you were watching Netflix. Good. You were reaching over to grab something, fell off the couch, and hit your head on the coffee table. Yeah. Could happen to the best of us. And because the impact was quite strong on your head, I'm going to perform a very detailed cranial nerve exam on you, okay? Yes, the most detailed. Now, have you ever had a cranial nerve exam before? Okay, so we do these as concussion preventions, also to see if you have been impacted by a concussion or some sort of disconnect between brain and sensation, okay? Yes, so we're just going to see that everything is working for you. I want to make sure that you're good from head to toes. And I want to make sure that the only problem we have to deal with is the bump on your head and nothing else, okay? So, we're going to begin first with basic diagnostics. So, would it be okay if I could just get your temperature? Thank you. Just going to put this under your tongue, okay? Let me know if anything is a bit uncomfortable. And we're going to wait 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Temperature appears to be a bit normal. A bit colder than usual, but you are hooked up to an IV bag, which can do that. Especially when looking at your blood pressure readings, it's a bit low, which can affect your temperature just a bit. Now I'm going to get your temperature. And the stethoscope may be a bit cold. I do apologize in advance for that. Would you be comfortable if I could just take your temperature on your chest? Thank you. I'm going to first place it right here. I want you to breathe in and breathe out normally. Good. So. going to check your back now. Is that okay? Good. Just going to reach over and check your back. Heart rate seems to be well. And a couple of quick questions. I'm going to check your limbs. I'm going to put pressure points on your fingers, each of them, and pressure points on your toes, each of them, and you let me know if you can feel that, okay? So first, let's pop out your right arm. Thank you. On the first finger, can you feel that when I squeeze your hand? Good. Second. Good. Third. Good. Fourth. And fifth. Good. Onto the left arm. Please hand your arm to me. Thank you. Let's touch your fingers. Just going to press on the finger pads. First one. Good. Second. Good. Third. Now that your toes are already on the bed, I'm just going to reach over and grab the right foot. I'm going to try the first toe. Can you feel that? Good. Second toe. Good. Third. Fourth. And fifth. Good. Left foot. First. Good. Second. Third. Fourth and fifth. Okay, all very good. I'm going to write that down. Normal functions working well. Sensitivity to hands and feet are good. Heart rate and temperature. And what concentration is that bag? IV bag seems to be drawing at a normal concentration, so it's good. Let's continue. A couple of quick questions. Are you experiencing any vertigo? That is, dizziness or ability to feel a bit nauseous when sitting in one position. Okay. And are you having any problems with your eyes? Okay. How many hands am I showing you? One. How many fingers am I holding up? 1, 2, 4, 3, 4, 5, 2, 1. Good. And are you experiencing any pain around your eyes? Or perhaps on this eye as it's closest to the impact zone? Okay, just checking. And do you remember the incident at all? Okay, it's okay to say you don't know. Okay, so you don't remember it. So, I'll just inform you that it might have been quite a bad one based off of that bump. I'm going to continue the exam now. Take a peek at your eyes. I have a pen light here. If it's too bright, let me know. If it causes double vision, let me know. If it causes vertigo as well, let me know, okay? Gonna cover one of your eyes. Just gonna take a quick look. I want you to keep focus on my eyes. Okay. dilation have been impacted. You only moved up about 1 millimeter. And again, moving up about 1 millimeter. I'm going to quickly check the other eye. Sit still. Keep looking in my eyes, don't look at the light. Okay. Okay. This I moved about 2 millimeters. Quick question. Any vertigo? Okay. Any tunnel vision? Okay. How many fingers am I holding up? And now. Now. And now. Now. And now. Okay. Which hand is closest to you, my left hand or my right? And again. Once more. And again. Good. I'm going to perform something called a visual field test. I'm going to check the boundaries of your eyes to see if your vision is impacted. What I want you to do is let me know when I get into your eyesight frame. Okay. Good. I'm going to just wiggle my hands until you can see it, and when you see my hand pop into frame, say now. Good. So, just look at me. Don't look for my hands. We're going to use our outer visual field to find the hand. Good. So, tell me when. Good. 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 Great. Good. 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 Great. Good. Good. Now I'm going to do it with both hands, and you let me know which hand you see first, my left or my right, okay? Good. Keep focus on my eyes. You're doing great. So, good. 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 Mm-hmm. 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 Good. And again, might be a repetitive question, but I must ask. Any signs of vertigo? Strained eyes? Right here? Fatigue? Okay. And then double vision? No. I'm gonna get a bit closer now with your eyes. I do apologize about the distance, but I must look. So, keep looking at my eyes. Okay, and can you now look at the pen light? Thank you, just follow it with your eyes as best as you can. Okay. Are you finding any discomfort with this eye? Yes, it did appear that it was moving a bit stagnant. What I mean by that is, if you could look at my finger, the eye moves a bit sharp, not as smooth as you'd like it to. It just means that your brain is overprocessing, especially after trauma, which is normal, especially after that bump that's right on top of that eye. I'm gonna check the other eye now. First, look at me, and I'll let you know when to look at the light. Okay? You're doing good. Before I begin, any pain in your eyes? Not much, okay. So, look at me first. Look at me in the eyes. Thank you. Okay. I'm going to ask you to follow the light again, okay? Thank you for cooperating with me. Okay, this eye's functioning a bit better. Okay. Okay. So, this eye on your right is more smooth. What I mean by that is your eye movement. If you could follow my finger, your eye movement tracks well. So just follow my finger and watch. This is how your eye movement is on your right eye. Very smooth. Okay. And on your left eye, it's just a bit more stagnant, which just means your brain is working a bit harder. If you could follow my finger and see. And this happens due to trauma, typically, or some sort of internal problem that can happen with the eye. Yes. Going down dilation drops in your eye really carefully. Let me go grab those. Just going to take a further look into your eye and test your vision. Do you have a Snellens chart, if you know what that is? I'd like you to look at it. So first going to pop some drops into your eye, okay? I'm just going to pull very carefully down the bottom of the cheek. And I want you to look up. Thank you. Just going to apply 3 drops in each eye. 1, 2, and 3. Blink. Blink that out. Please. Take time to blink that out. Very good. And the other eye. 3 drops. 1, 2, 3. Blink that out. Just blink it out. Very good. I'm gonna go grab my Snellens chart now, and we're going to be right back to this. I have it pulled up onto my computer here. What I'm going to do is just test your general vision with each eye. So, I do see that there could be a bit problem with the light reflection behind you, but we're going to make it work, okay? So, standing a meter away from you, going to point at different letters, and you let me know if it gets difficult or if it's clear to see, okay? I want you to just list out each letter I point to. Good. So, please close this eye, and we're just going to be pointing to some letters. Thank you. What is this one? That is an E. Good. Now, what about here? F. And here. P. Okay, so 1 and 2 done. Now, let's check here. Can you see this letter? Good. What is it? T. And over here. Oh, very good. And here? C. Good. Let's move down now. Third line, good. To the fourth. Can you see this letter here? Oh, very good. What about here? P. E. Good. And D. Good. I have to ask, so far, are there any lines that are beginning to get a bit blurry? Okay. Below 4. And in your chart, it was missing. Do you wear any contacts, or have you had any vision problems, or do you wear glasses? Okay. Good to know. Let's go down here. Can you see this letter? P. Okay. It's getting a bit difficult down here. That's normal. And here? E. Okay. Here. C. Good. F. And D. And this is the basic line. I'm gonna start off right here. Line 5 was good. On to line 6. Can you see down here? Yes. How does E? D. F. C. C. And P. Marvelous. Can you see any line below number 6? Not so much. Understood. And I'm going to point at something here. Can you tell me what color that is? There's a little square here. And what color is this square? Okay. And what color is this square below here? Okay. Do you have any color blindness that runs in the family, or do you know if you're colorblind or color deficient? Okay. I want you to open this eye now. I'm going to ask you a couple of questions. Did you find it difficult to read? Only when we got to the bottom, okay? Did you find that identifying the colors were difficult? Okay. How are you feeling now? Any double vision? And any discomfort with your eyes or headache? Migraine? Vertigo? I'm gonna check between everything to make sure, because your health is the whole purpose of you being here. I want you to be good. I would like it if you could close this eye now. We're gonna try on the other eye. And don't push yourself if it is a bit difficult, because again, you have experienced trauma on this eye, and as it did lack in dilation, I think it might be a bit blurry. So I'm gonna stand back a meter. Close this eye, please. Thank you. We're gonna do this test, okay? Again, don't get nervous if it is a bit difficult. Okay, so are you able to identify this one? Yes, that's an E. Good job. Line 1 complete. Line 2. Can you identify this letter? F. Good. And P. Good. And are you experiencing any difficult reading line 3? Just a bit. Can you tell at all what letter this is? Yes, that is a T. What about this? Yes, that is no. And what about this? That is a C. Good job. Can you tell any of the letters below here? Partially. Let's give it a shot. What about this letter? An I. Okay, that's an L. Next to it. A P and or a D. Okay. And this. E. And what about here? A D or an O. Any ability to see anything below, or is it a bit blurry? Very hazy. Okay. Thank you. I'm just going to quickly write down what I noticed. Inability to read below 6th line on eye with impact and trauma. I'm going to take a closer look at this eye particularly because I have a sneaking suspicion that there's some swelling back there. Ability to see similar in both eyes was incorrect. I think I forgot to ask for your prescription for your eyes, or in general. Did you notice that one eye works a bit better than the other? Typically we have one eye that works better. And would you say that the difference between your eyes is considerable? Okay, not so much. So, considerable difference between eyes, not known prior. We're going to leave that blank as to why, because I don't know yet. I'm going to get some gloves on now. So, I'm going to put these fancy goggles on. They make me look like I'm from outer space. What they're used for is to check your orbitals. An orbital eye exam, and I'm going to check the back of your eye, quite literally, shine a light into it and see if there's inflammation. Yes, it does not hurt, trust me. You won't feel a thing. It's just like a very strong magnifying glass, and it does make me look like I'm from 2077. It's quite cool. Trying to get these gloves on. Very good. Before I begin, I'm just going to press around your eyes. I want you to let me know if anything feels uncomfortable or sensitive. Good. So, anything here? Here and here, here, here. No. Quick muscle test. Copy me really quick. Can you raise your eyebrows? Good. Can you squeeze your eyes really tight? Good. Give me a big smile. Thank you. And give me a big frown. Thank you. That's very good. So, I'm going to quickly grab my glasses and we're going to examine your eyes. So, here are my fancy glasses. We're going to first take a look at the impacted eye and then a quick glance at the other eye to see if it's the same. So, going to turn the light on this. I want you to look at the light if possible, if it bothers you. Look at my nose. So, this is going to get a bit up close. We're just going to look around your eye, okay? What I'm looking for is a particular type of swelling or trauma behind the eye. Please keep focus on the light or my nose. Okay, I'm gonna get a bit closer. I do apologize. Just gonna take a look here, okay? I'm just going to analyze everything. Just gonna take a quick look and see at the back of the eye. The orbitals is actually experiencing good orbitals. The orbitals seem to be affected on such a case. The back of the eye and the wires behind the eye are a bit swollen, which is due to trauma and pressure on the eye. So I'm noticing that there's a bit of a difference. It's quite interesting. So I'm just going to notice that there is quite a bit of a difference there because the swelling has overtaken the eye, which is quite normal. As the swelling would be overwhelming just a little bit. Could you please close this eye for a second? I'm going to put pressure on your eye and I want you to let me know if it's a bit uncomfortable. Thank you. I'm just going to put pressure right here. Okay, it looks like you're flinching a bit with your other eye, which means that it is quite uncomfortable. Is this normal with your eye or is this a bit new? It's a bit new, okay. I'm going to go back, open your eye again, keep looking at the light. Thank you. So, uncomfortability amount with the swelling does appear to be taking over by quite a bit. So this is something that we do need to document as the trauma must have gone to one of your orbitals. Very common. So very common, very common, very common. I'm going to turn the light up a bit brighter. Sometimes I turn it off by accident. There you go. This is just a bit brighter. I'm going to turn it a bit to shine it right into your eye again. Keep looking at the light of my nose. And I am seeing very clearly that this appears to be the case with this eye. The swelling does appear to be overcompensating for most of the functionability of your eye, resulting in the stagnant movement that I saw prior from the quick eye exam and the light exam. And I'm also assuming that this is one of the reasons that your eye is experiencing a bit more swelling and pressure, which probably could cause vertigo if this was not treated. So it's good to know that that's the case. Thank you. I'm going to switch the eyes now. There we go. I'm going to quickly examine the side to see if it's the same or a bit different. So, same thing here. Look at the light on my nose. Thank you. So I'm just going to pop it a bit closed. And yes, that's exactly what I expected. This eye does not appear to have any swelling, irritation, or redness at the back of the pupil. I'm going to get a bit closer here. And I do not see that there is any sense of irritation or readiness that could have been put to any sort of uncomfortability for you. So I'm glad that there is a very distinct difference between the two here. So I'm very glad. I'm going to shine it a bit brighter now. Might turn it off on accident. There you go. It's very bright now, I know. Just going to take a quick look. I don't see nothing here that could be of concern. Very good. I'm going to quickly jot that down. As the swelling at the back of the eye with trauma is something we need to note and could also be a potential cause of concussion that I should check for. if I've asked prior, have you ever had a concussion or fallen? What I'm going to do now is we're going to check your ears and perform a quick hearing test, okay? Good. I have this otoscope here, and I added a new cap on. What this does, it's going to allow me to look right into your ears, and it has a little magnifier in the back. I'm going to peek up your nose and take a look in your mouth. Okay, so I'm just going to get a bit close to your ear now. So I'm going to just add this little light right into your ear. Okay, this ear with the trauma has a bit of swelling and irritation. Okay, I'm gonna have to remember that. Okay. So this could actually be impacting vertigo and your center of balance, so I really should be noting that down. I wonder if this ear has a bit of hearing impact as well. Gonna check the other ear. Pop a look. And I'm seeing exactly what I see normally, so this is no new news. Very similar indeed. Okay, so see that we are quite impacted by this. Let's take a look again. Popping and looking. I do see that the ear is experiencing no swelling, so just as I predicted. Let me go back to this one. Yeah, there appears to be swelling and irritation on this ear. I'm going to try to get samples of each ear. Just to make sure that you're healthy, I'm going to just take quick cotton samples of each ear. I'm going to send it into the lab. So, it's just that this one looks a bit irritated, which I think could have been something else prior before to the impact. Okay? Are you doing good? This might cause vertigo. Let me know if it does, because it might be a very clear tail sign that there is a concussion. Thank you. It's going to pop this in right here. You okay? Good. Okay. I'm going to switch to the other ear now. Okay. Okay, I'm going to send these both in, left ear, right ear, to send it into a lab. Let them see if there could be a potential sinus infection or something going on with your ear that we need to pay attention to, okay? Because this could also very much so function with your ear functionality, causing you vertigo, imbalance, uncomfortability, nausea, seasick. Okay. Go put these down and let me get my tuning fork as we're going to test your hearing. So, have my tuning fork now. We're going to do a test. I'm going to ask you which ear you hear this on, okay? So I want you to close your eyes. I'm going to test you to see which ear you hear it from. Good. So. Okay. And anything? You felt like it came from both ears, okay? Let's do it again. And which ear did that come out of? This one, okay? Once more. It's a bit softer, but this side. Okay, let's do it again. On which side? Okay. Where did that come from? Okay. And once more. Down the center. Okay. So I'm going to quickly put my hands on your ears. And I want you to let me know if you can hear in one side a bit better and a bit different in the other. I'm going to be cupping your ears. Okay? So I'm just going to put my hands right beside your ears. Okay? So I'm going to put my hands here, and I want you to let me know if one side you hear a bit more than the other. And was there a side you heard more than the other? That's what I thought, a bit of hearing loss on this side as well. So, when you got hit, it may have hit directly at your head, causing swelling in the eye and swelling in the ear. Yeah. And because I put pressure on your ears, do you feel any sensitivity or vertigo? Okay. I'm glad there's no vertigo, but just to make sure, I'm going to keep asking to make sure. Now that we're done with the hearing assessment, and we know that this side has been impacted, I'm going to test your nose. It's something called the Olifactory sensory test, and it's to see if you can identify smells. I have about 7 different vials here of different types of essential oils, and all you have to do is try to identify to the best of your ability. There is no correct answer for what one thing smells like. In fact, on the bottle it says a range of things it could smell like. Okay? Good. Let me put this down. We're going to begin with this one. First question is, can you tell me what color this is? Very good, it's blue. And I just want you to let me know what smell you think this vial is, okay? Just to the best of your ability. Mm-hmm. A bit earthy. Smells like something you've smelled before. And what would that be? Espresso. Very good. It is coffee, and we would have accepted natural smells, coffee, good. Let's move on to the next. The next one we have is this one. And again, first question. Can you identify this color? Okay. Yes, it is red. And oh, it's quite a lovely smell. Are you able to identify this smell? Mm-hmm. Mm-hmm. Earthy. Like a bakery. Like a cupcake. And any identifying word to put to this? Vanilla. Good. It is vanilla extract. Let's move on to the next. On to our third one. And could you let me know what color you think this is? It's quite light. Yes, that is a baby pink. Now, let me know what you smell. Hmm. Hmm. Okay, so it's a bit minty. Well, that's the perfect answer. This is actually peppermint, and you did very good identifying that. On to the next one. On to the fourth. Got an interesting one here. And this one is, yes. Can you first tell me what color you see? Yes, a green. Now, give this a shot at what you smell. And remember, everything is correct. So just take a guess. Mm-hmm. Mm-hmm, I understand. Mm-hmm. Hmm. So you think it's a bit fruity. What fruit? Like a raspberry. That's very good. It's actually blueberry. And very good answer to that. Now on to the questionable essential oils. Let's begin with the more generic essential oils. This one has a lot of smells it could be. So, try giving that a bit of a smell. And just let me know what you think that could be. Mm-hmm. Mm-hmm. A bit woody. A bit like the earth. That's good. This is actually mahogany. So, it can be a lot of those smells, which is accurate. So far, you're doing great. On to the next. This one is a very generic essential oil. You've definitely smelled this before. This is quite luxurious. And what do you think this is? kind of flower is that? Lavender. Very good. This one is indeed lavender. One more to go. And on to the final one. This one is typically the most difficult for people. Difficult for myself to identify as well, but I'm gonna give it a try. Okay. Yes, it is a bit intense. Any idea what that is? Reminds you of home. Reminds you of warmth. Any guesses? Like a flower? I would say that's accurate. It's actually an herbal tea. A black tea. It's a good smell to see if you can identify a bit of a bitter note. Very good. Just going to quickly update your files here, noting that your sense of olfactory sensory nerve is working well. That's actually really good to know, because sometimes when your cranial nerve is impacted, you actually can't smell as well as you think you could. Yeah. I have had a concussion or two in my day, and there have been moments where I quite literally hit my head so hard I did not know what coffee was. Just because it, bit of problems when I did hit my head. So, you're in good hands. We're going to do one final assessment, which is what we like to call the Muscular Assessment. And what this is muscular reflexes with your face, neck, and shoulders. And it's kind of like a follow my instructions type situation, where I'm gonna ask you to do kind of funny and silly things as I did during the eye exam, but way more detailed now. Yes. So, what I want you to do first is, if you could just form your mouth into the shape of an O, like ooh. Yes. And if you could, I'm just gonna put my hands around your mouth. Is that okay? Thank you. So, if you could make the sound O for me. Oh, just make the sound O. Very good. Are you feeling any pain or sensitivity from your ear to your jaw? No, that's a good sign. Now, if you could lift your eyebrow the most that you can raise it, look very shocked, okay? I want you to try and hold that for as long as possible. I'll be counting, okay? So let them rest a bit, and then raise them in 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and release. Thank you. It's a bit of a stress, I know, but it's to test to see if your muscles are working well. Facial muscles mean everything when in connection to your brain. Now, I would like you to try and just open your eyes super wide for me. Just super wide. Okay. Very good. And now can you close them really tight? Yes, close them really tight as if you're trying to block out all light. Okay, that's good. Do you feel any uneasiness when you do that? No. open your eyes. Very good. Now what I want you to do is give me a very cheesy smile, but open your mouth as wide as possible. So just ah. Yes. I'm gonna put my hands right next to the sides of your mouth. And just open your mouth as wide as possible. I'm gonna put pressure right here. Very good. You can release now. I know it's a bit uncomfortable. Now I'm going to put my hands right next to your lymph nodes. We're just going to check your lymph nodes. Just making sure that they're all proper. Nothing's swollen there, so that's good. My hands out back here, and I want you to swallow for me. Just swallow. Very good. Muscular system for the swallowing. Good. Now, if you could stick your tongue out for me, just go, stick your tongue out. Thank you. I'm just gonna put my mouth here. My hands are next to your mouth. And is it possible that you could try to wiggle your tongue back and forth? That sounds silly, but again, sometimes if you do hit your head, you are unable to do certain things. So I'm trying to check to see if everything works properly, okay? Yeah. So wiggle your tongue back and forth. Good. Can you now extend your tongue? But make sure that you're trying your best to push it out of your mouth. Okay. Very good. You don't need to do that anymore. So I'm going to say that your facial muscles are working properly. Now I'm going to put my hands on your shoulders. So shake it out a bit. And I want you to try and lift your shoulders for me. Just lift them. Just shrug your shoulders. Very good. And release. Now I want you to shrug your shoulders, but I'm going to put very firm pressure on your shoulders for 10 seconds. Fight that pressure. Do not let me push your shoulders down. Okay, try your best. Here we go. 3, 2, 1. I'm pushing. 2, 3, 4, 5, 6. Fight this. 7, 8, 9, 10. Perfect. Very good. Now I'm actually going to take your head and move it around a bit. Bit uncomfortable, but let me know if it makes you feel uncomfortable. I'm going to tilt your head certain angles, and I want you to just keep looking at me in my eyes. Do not shift your head yourself. Let me shift your head for you. Okay, good. So just going to move your head a bit. Okay, keep looking at my eyes. I'm going to tilt your head now side to side, and let me know if there's any discomfort, okay? Okay, so we're just going to tilt a bit. Keep looking at my eyes. Very good. Any signs of vertigo when I tilted your head? No, that's a good sign. I'm going to tilt it the other direction now. Tilt. Any signs of vertigo? And just keep your head in normal posture. Okay? I think that's comfortable enough. Are you feeling okay? Good. And one last test. To do an overall assessment of your head. To your feet. To your feet. And your arms. Very good then. So, it looks like we are done with your cranial nerve exam, and let me just quickly explain to you your results. So, After following through with what appeared to be a numerous set of exams, the only thing that I found was a bit troublesome was with your left eye. And here it actually says that I should send you to an eye specialist, which I will. Just to see if the swelling is something that will go down with time or if, we need to take more care of as well. It was with this left ear, as there was also swelling due to the trauma that you had on your head. Your other results came back that you were fine, so no sign of muscular problems, no sign of no control. As well, I'm very happy your olfactory sensory was working properly, and I'm really happy that this right eye is working well. So, what we're going to do now is I'm going to let you rest for the night, but in about 12 hours time after you sleep, we're sending you off to an eye specialist to get checked, and then your specialist to get your ears checked and cleaned. And I'm also going to watch you overnight while you sleep and watch your vitals, just because if it is a concussion, sometimes falling asleep isn't the best thing to do until you're properly seen. Yeah, exactly. So we want to watch you and your vitals for as long as we can, making sure that we go over every basic step of proper care, such as your health, your breathing, your blood pressure, etc. Now, a question before I leave. Would you like me to bring a nurse in to get you some pillows, blankets, something to drink, something to eat? Are you hungry at all? Okay, you would like a snack? I'll send the nurse and then to come take care of you. So I know these bed sheets are a little bit uncomfortable. That's okay, we'll send in a better blanket. Something that isn't made of like 10 ply. Yeah. So we'll get you some new blankets and pillows. If you're able to stand up and walk, go ahead and mosey around, but be careful as you are connected to a couple of wires here. Yeah. In the meantime, if you ever need any help or feel like you need to contact someone immediately for medical help, the button to your right, push it, the big red button on the bed. Yeah. It will bring one of the nearest nurses and also alert me on my pager to come and see you, or one of the other doctors that are nearby. Yes. And I do hope you have a pleasant day. I do know that maybe your memories will come back to you. Sometimes they don't. But I hope you get better soon. We're gonna make sure that we get this eye and that ear checked out, okay? Proper good. Again, I am Dr. Luna. Truly a pleasure to meet you. Thank you for sitting through such a long exam. Have a good evening.